Thank you, Mr. President. Mr. President, Excellencies, thank you for giving me the opportunity to address this very important meeting of the Security Council. Mr. President, the health sector in Gaza is under attack. Hospitals are being deliberately targeted in a desperate attempt to force the civilian population out of Gaza. The last 24 hours saw the targeting of at least 4 hospitals in Gaza. Al-Shifa Hospital, with tens of thousands of people sheltering there. Al-Auda Hospital, where our ambulances were bombarded and the emergency paramedics miraculously escaped certain death yesterday. Also the Indonesian hospital and our Al-Quds Hospital. Mr. President, I had to rewrite this statement few times in the last few hours, as the situation around the hospitals is changing by the minute. Displaced people at the hospitals are getting shot at as we speak. During the last call with my colleagues at Al-Quds Hospital 2 hours ago, they told me that 20 people have been injured by direct firing at the hospital. 1 person has been killed. They are asking, what can they do? Where should they go? Thousands of innocent lives are under imminent threat of being killed. I'm calling upon the council members on behalf of the staff and volunteers of the emergency medical teams, the doctors and nurses who are besieged in Gaza hospitals, to do all you can to spare further deaths and sufferings. There are 14,000 displaced civilians at Al-Quds Hospital, in addition to 400 sick and wounded, together with our medical teams and management. The main generator was shut off 2 days ago because of lack of fuel. Right now, there is a very serious risk that we will lose all the patients in the intensive care units and those children in incubators. Mr. President, I was prepared to inform the Council about the critical shortages of fuel, food, and water. But honestly, now our utmost concern is the direct threat to the lives of all those wounded and sick, together with tens of thousands of civilians, including thousands of children. They are looking at you, imploring you to act to stop another possible massacre unfolding. In addition to the imminent threat of being shot and killed, the 14,000 displaced civilians at the hospital are getting restless and desperate because of lack of water, food, and electricity. We are witnessing the spread of diseases and increasing infestation of wounds with worms and among children. A child was treated yesterday for eye infection. The doctor found worms in his eyes. Mr. President, the medical teams have left their families to help save the lives of the wounded and the sick, but many of them received the news of losing so many loved ones. Dr. Nabil, a board member and now a volunteer at Al-Quds Hospital, lost 36 members of his family. The chair of our board has lost 20 members of his family. One of the founders of PRCS lost in one day 20 members, and the next day another 13. The description of the situation at Al-Quds Hospital does not and cannot describe the absolute horrors, the trauma, and the psychological scars of sleeping every night under the terrorizing bombardment and not knowing whether they will be alive the next morning or not. Mr. President, PRCS is taking the main responsibility to receive humanitarian aid through the Rafah crossing and distribute it to humanitarian organizations and to the hospitals and shelters. What has come in so far represents less than what used to get into Gaza in 2 days. At the same time, there has not been any drop of fuel that entered Gaza, which is essential for every aspect of life, for hospital operations, for pumping water, for bakeries, for ambulances, and for the trucks which are transporting the humanitarian aid. If this prohibition on fuel continues, we will not be able to continue to receive this aid and distribute it. Furthermore, if no aid gets to the north of Gaza Strip, we will soon see infants dying because their mothers cannot feed them. Many people will starve and die of diseases. Mr. President, we call on the Security Council and the international community at large. One, to ensure an effective and immediate ceasefire is enforced. To ensure fuel gets into Gaza immediately to prevent additional unnecessary deaths and sufferings. Increase humanitarian aid and ensure that unconditional humanitarian aid gets to the north of Gaza, where tens of thousands of people are still there and have no safe places to go to. Ensure respect for international humanitarian law and the protection of medical missions and civilians in all parts of Gaza. Ensure hospitals continue to function with the needed support of fuel, medicine, medical supplies, and to allow medical teams to enter Gaza to relieve the teams who have been working tirelessly 24/7 for the past 35 days. Mr. President, Excellencies, please listen to the cries of children soaked in blood and asking why, and what have they done, and why the world is so indifferent to their lives. I thank you, Mr. President.